Welcome everyone, and thank you for joining us today. I'm excited to kick off this training session titled Visu Online Medical Coding Training. Step into your success. Today, we'll be focusing on HCC coding guidelines, specifically related to diabetes. Over the course of this presentation, we'll explore key guidelines, best practices, and practical tips to improve your coding skills in this area. So, let's get started and make this a productive learning experience. HCC stands for Risk Adjustment Model, and it's a key component in how reimbursement is determined. Essentially, this model helps ensure that the payments reflect the health status and complexity of the patients we serve. Because of this, accurate coding becomes absolutely crucial. If the coding isn't precise, it can lead to incorrect risk assessments, which ultimately impacts how much we get reimbursed. Today, I want to introduce you to the concept of HCC and why it matters so much in our workflow. Understanding this model helps us see the bigger picture, how every detail we document influences the financial and quality aspects of our practice. So, let's dive a little deeper into how HCC functions and what we need to keep in mind to get it right. Today, I want to talk about chronic hyperglycemia, which is a key feature of diabetes. Chronic hyperglycemia refers to consistently high blood sugar levels over time, and it's a hallmark of the condition. When blood glucose remains elevated, it can cause various complications if not managed properly. Now, there are two main types of diabetes, and they are classified with specific codes. Type 1 diabetes is coded as E10, and it usually results from the body's inability to produce insulin. This often develops early in life and requires insulin therapy from the start. On the other hand, we have type 2 diabetes, coded as E11. This form is more common and typically involves insulin resistance, where the body doesn't use insulin effectively, often associated with lifestyle factors like diet and activity level. Understanding these distinctions is crucial because they influence how we approach treatment and management. Throughout this presentation, we'll explore these types in more detail and look at how controlling blood sugar is vital for preventing complications. Remember, both types highlight the importance of managing hyperglycemia to improve patient outcomes and overall health. Let's take a closer look at the classifications within HCC categories. First, we have HCC 17, which pertains to acute complications. These are the immediate issues that can arise suddenly and often require prompt attention. Then, there's HCC 18, covering chronic complications, which develop over time and may persist or worsen if not managed properly. Lastly, HCC 19 refers to cases with no complications at all, indicating a stable condition. Understanding these categories helps us better assess patient needs and tailor our approach accordingly. Recognizing whether a patient faces acute or chronic issues, or no complications at all, is essential for effective treatment planning and resource allocation. This classification system ties into the overall theme of our presentation, emphasizing the importance of accurate patient stratification for optimal care. Let's take a closer look at E11-9, which refers to controlled diabetes without complications. When we say controlled, we're talking about a condition that is well managed through medication, lifestyle changes, or other interventions. It's important to note that this classification indicates the patient's blood sugar levels are kept within target ranges, reducing the risk of developing serious issues. This is a key point because well-controlled diabetes can significantly improve quality of life and prevent the onset of complications like nerve damage, kidney problems, or vision loss. When we see without complications, it suggests that so far, the disease hasn't caused any secondary health issues, another positive indicator of effective management. In the context of overall healthcare and coding, recognizing controlled diabetes helps us understand the patient's current health status and guides treatment plans. It also plays a role in resource allocation and insurance considerations. So the main takeaway here is that controlled diabetes, especially without complications, reflects a stable condition that's being actively managed, which is essential for maintaining overall health and preventing future problems. Today, I want to talk about some of the acute complications related to diabetes, specifically DKA and hyperosmolarity. On this slide, we see the codes E1110 for diabetic ketoacidosis, or DKA, and E1100 for hyperosmolarity. These are serious issues that can occur when diabetes isn't properly managed or during times of stress. Let's start with DKA. It typically happens in type 1 diabetes when there's a severe lack of insulin. Without enough insulin, the body starts breaking down fat for energy, which leads to the production of ketones. These ketones are acidic, and their buildup in the blood causes the characteristic symptoms of DKA, like nausea, vomiting, abdominal pain, rapid breathing, and even confusion. It's a medical emergency that requires prompt treatment. Now, moving to hyperosmolarity, or more specifically, hyperosmolar hyperglycemic state. This usually affects people with type 2 diabetes and occurs when blood sugar levels become extremely high, leading to a very high osmolarity, or concentration of particles, in the blood. Unlike DKA, there's usually little or no ketone production here, but the dehydration and high blood sugar can cause severe neurological symptoms, like confusion or even coma if untreated. Both of these conditions highlight how crucial blood glucose control is in preventing severe complications. They serve as a reminder that managing diabetes isn't just about keeping blood sugar in check, but also about understanding the risks and recognizing early warning signs. Ultimately, our goal is to prevent these emergencies through proper management and patient education. Now, let's take a closer look at some of the chronic complications associated with diabetes. On this slide, you'll see E1121, which refers to nephropathy or kidney disease caused by diabetes. This highlights how high blood sugar levels can damage the kidney's filtering system over time, potentially leading to kidney failure if not managed properly. Next, we have E1140 neuropathy, which involves nerve damage. This can cause a range of issues, from numbness and tingling to pain, often starting in the feet and legs, and sometimes affecting other parts of the body. Then there's E11319, retinopathy, which is damage to the blood vessels in the retina of the eye. This can lead to vision problems and even blindness if it progresses without proper treatment. Overall, these chronic complications underscore the importance of controlling blood sugar levels, as persistent hyperglycemia can lead to serious, long-term health issues. Managing these risks is a crucial part of diabetes care, helping to prevent or delay the onset of these complications. E1140. So, let's talk about numbness and tingling, which are common symptoms many people experience. These sensations often indicate nerve involvement, and when they persist, it can point to a condition called neuropathy. Neuropathy essentially means that the nerves are not functioning properly, often due to damage or disease. Recognizing these signs early is important because they can be an early warning of underlying issues, such as diabetes or other systemic conditions. Understanding these symptoms helps us connect the dots in the broader context of nerve health and overall well-being. Let's take a closer look at E11319, which refers to a specific diagnosis code. This code is associated with blurred vision, a common symptom that many patients experience. Blurred vision can be caused by a variety of underlying issues, but in this context, it's linked to retinopathy. Retinopathy is a condition where the blood vessels in the retina, the light-sensitive layer at the back of the eye, become damaged. This damage can lead to vision problems, including blurriness, and if left untreated, it can even cause significant vision loss. The key point here is that blurred vision isn't just a minor inconvenience. It can be an early warning sign of underlying retinopathy. Recognizing this symptom is crucial for early intervention. This ties back to our overall theme of the importance of early detection and management of eye-related complications in systemic conditions like diabetes. By catching retinopathy early, we can prevent more severe outcomes and preserve vision. So remember, if a patient reports blurred vision, especially if they have risk factors like diabetes, it's vital to investigate further for possible retinopathy. Let's take a closer look at proteinuria and nephropathy. Proteinuria simply means the presence of excess protein in the urine, which is often an early sign of kidney damage. When the kidneys are injured, their filtering units, the glomeruli, become more permeable, allowing proteins that normally stay in the blood to pass into the urine. This is a crucial marker we monitor because it signals possible underlying kidney disease. Nephropathy refers to kidney damage or disease itself. It can be caused by various conditions, including diabetes, hypertension, or other systemic illnesses. The key point here is that persistent proteinuria is not just a symptom, but also a risk factor for the progression of kidney damage. It's often used as a marker to assess the severity and progression of nephropathy. Understanding these concepts helps us connect to the broader theme of how systemic conditions impact kidney health. Managing proteinuria early can significantly slow down or prevent further nephropathy development, which emphasizes the importance of early detection and intervention. All right, let's take a closer look at the slide. The coding here, E11621 plus L97, XXX, refers to specific diagnostic codes. The first part, E11621, is the ICD-10 code for type 2 diabetes mellitus with foot ulcer. This highlights how common foot ulcers are among diabetic patients. The second part, L97, XXX, covers various types of non-pressure chronic ulcers of the lower limbs, specifically focusing on the foot region. What's important to understand is that foot ulcers are a serious complication of diabetes. They can lead to infections, hospitalization, and in severe cases, even amputations if not managed properly. Recognizing these codes helps us document and track these cases accurately, ensuring patients receive targeted treatment. Throughout this presentation, we've emphasized how vital it is to understand the root causes, proper management, and preventive strategies for foot ulcers, especially in diabetic populations. So, this slide ties together the clinical coding with the overarching goal of improving patient outcomes through precise diagnosis and intervention. Let's take a look at how we can code complications effectively. For example, if a patient has both diabetic retinopathy and diabetic nephropathy, we would code E1122 for the retinopathy and E1140 for the nephropathy. Now, it's important to remember that we can also use multiple coding when a patient has more than one complication. This ensures we accurately reflect the full scope of the patient's condition. By doing this, we improve the accuracy of documentation and billing, and also support better patient care. So, always be thorough and precise in coding complications, especially when multiple issues are present, to capture the complete clinical picture. Let's take a closer look at Z794, which specifically applies to insulin use. Now, this code is only relevant for patients with type 2 diabetes who are using insulin as part of their management plan. It's important to emphasize that insulin therapy isn't always the first line of treatment for type 2, but when it is used, proper documentation with this code helps ensure accurate coding and billing. Understanding that insulin use here is tailored specifically for type 2 diabetes helps us avoid confusion with type 1, where insulin is often a given from the start. So, when documenting insulin use in type 2, make sure to note this code, Z794, to reflect the ongoing insulin therapy accurately. This clarity is crucial because it informs the overall management plan and supports appropriate reimbursement. Remember, precise coding like this not only helps with billing, but also ensures the patient's treatment is well documented for ongoing care. Let's take a closer look at some key medications used in diabetes management. First, we see the code Z7984, which relates to the documentation of ongoing medication use. Moving on, metformin is highlighted here as a cornerstone of oral drug therapy for type 2 diabetes. It's widely used because it helps lower blood glucose levels effectively and has a good safety profile. When we talk about oral drugs, metformin is often the first choice due to its benefits in improving insulin sensitivity. These medications play a crucial role in controlling blood sugar levels and preventing complications, fitting into our overall goal of comprehensive diabetes management. Let's take a closer look at some of the key diagnostics we use to monitor and manage diabetes. First up is HbA1c, which provides an average blood sugar level over the past 2 to 3 months. It's a crucial measure for understanding how well someone's blood glucose is being controlled over time. Next, we have fasting or random blood glucose tests, which give us immediate snapshots of current glucose levels. These are essential for diagnosing and tracking the disease on a more regular basis. Lastly, the eye exam is a vital part of diabetes management because high blood sugar can lead to complications like diabetic retinopathy. Regular eye exams help us catch early signs of damage and prevent vision loss. When we combine these diagnostic tools, we get a comprehensive picture of a patient's condition, enabling us to tailor treatment plans effectively and prevent serious complications. Now, when it comes to treatment options, there are a few main approaches to consider. First, we have insulin therapy, which is essential for many people, especially when other methods aren't enough to control blood sugar levels. Then, there are oral medications, which are often the first line of defense and can help manage the condition effectively. Finally, lifestyle changes play a crucial role. They include adjustments like diet, exercise, and weight management that can make a significant difference in controlling diabetes. Combining these approaches allows for a comprehensive treatment plan tailored to each individual's needs, helping them stay healthier and more in control of their condition. Let's now focus on the concept of highest specificity when linking conditions. This is all about ensuring that the conditions we use to connect different pieces of information are as precise as possible. By doing so, we minimize ambiguity and improve the accuracy of our conclusions. It's important to choose key guidelines that help us identify these specific link conditions clearly. Remember, the goal is to create strong, well-defined connections that support reliable decision-making. This approach ties back to the overall theme of building robust, trustworthy systems that can handle complex data effectively. So, always aim for the most specific link conditions you can identify. That's where the most meaningful insights come from. Thank you very much for your time and attention today. I hope you've gained valuable insights into the Visu online medical coding training program. Remember, this training is designed to equip you with the skills needed to excel in medical coding, which is a crucial part of healthcare administration. If you have any questions,